I'm Julia Borston here for Tech Check with Isabel Kenyon, the founder and CEO of Calibrate. Isabel, thank you so much for talking to us today.
Thank you for having me.
So, Isabel, you have some very big news. You're raising $100 million, bringing your total raise to over $127 million. And what's so remarkable to me about this is that Calibrate just launched as a product last June. You just launched the whole company in November of 2019. So the company is less than 2 years old. Tell us first, what is Calibrate? How does this company work?
Calibrate is a metabolic health business on a mission to change the way the world treats weight. Our platform lets consumers access a doctor and an intensive lifestyle intervention delivered entirely virtually. Intensive lifestyle intervention is a way to change the way you eat, sleep, exercise, and manage your emotional health. We deliver it through virtual one-to-one coaching, content, curriculum, community, and the combination is the most effective thing that we know about to treat obesity long-term and sustainably.
And so what's really interesting to me here is there are all these other digital health tools focused on weight loss. There's WW, formerly Weight Watchers, there's Noom, but what really distinguishes what Calibrate is the relationship with doctors and the one-on-one coaching, and the fact that a lot of your customers presumably are going to be prescribed weight loss medication.
All of our customers are prescribed medication because we believe that obesity is a chronic disease that should be treated with biology. And the big difference between Calibrate and conventional weight loss players is this idea that conventional weight loss players are still telling consumers that it's about willpower, and Calibrate is telling them that it's about biology. And so we treat biology with biology, and every member uses the combination of medication and intensive lifestyle intervention.
And so your customers are paying an annual fee. Tell me how the payment works, and also give me a sense of your revenue to date.
Today, consumers pay the cost of the program fee for Calibrate, but their insurance company pays the cost of the medication, which is actually anywhere from 70 to 90% of the cost of participating in the program. Part of the fundraising that we're announcing today is that we're going to go find payers to pay for the cost of the program too. Employers, the government, Medicare, Medicaid plans who are interested in paying for the cost of the program based on the results that we've demonstrated so far. We announced today that our first set of members who passed the 1 year mark have lost 14% of their body weight, far exceeding what we saw in clinical trials, which was 10%. The business is on track to do $21 million of revenue in our first real year of business this year.
$21 million of revenue in your first year of operation is really remarkable. To me, what's most striking about this $100 million raise is just how quickly everything happened. So you founded the company in November 2019, and then you launched in June 2020, which of course was just months after the beginning of the pandemic. Tell me how you were able to do that so quickly, and also what was driving you, not just to found the company, but to specifically get the product out as quickly as you did.
So for me, it was personal. My mom had a doctor's appointment. She learned that she needed to lose weight. I helped her find a doctor to do that. And we both could not wrap our heads around the fact that there are doctors who are obesity board certified, who have known how to treat obesity for 20 years, that there's really amazing clinical research on it, and that we're not getting that to people. And so for me, that became the urgency, that became the call to action. This is 175 million American adults who are impacted here. How do we get them treatment? How do we get treatment to as many people as possible, as efficiently as possible, with as much scale as possible? And so for us, we were planning to launch during the pandemic. We were planning to launch brick and mortar. We redid the entire business to launch entirely digitally, and we launched in that June of 2020.
And so when you say you're planning to launch brick and mortar, it seems like the doctor piece of this and the one-on-one coaching is so crucial to the business model. Were you planning to have doctors meet with patients in their offices, and then you switch to have everything virtual? Tell me how that worked, and also sort of how much bigger the potential is if you're not relying on physical locations.
The potential is so much bigger without physical locations, and the consumer intent is there now because of COVID, right? Before COVID, you might not have been comfortable seeing a doctor on telemedicine, and today you are. But more importantly, I think before COVID, you weren't really focused on your underlying health. What are the conditions that put you at risk for other types of chronic disease? And COVID has shown such a spotlight on our metabolic health, and that being the real cornerstone of our overall health and our risk factor for COVID. As we let people get the vaccine in every state based on whether or not they had obesity, hypertension, high blood pressure. Like, these are the things that we really, really understand now we have to take care of. And so it's been a huge catalyst for the business.
So COVID has been a catalyst for the business in terms of people understanding the importance of losing weight and taking action to do so. Do you think it'll also be a catalyst in terms of getting these new partners that you're hoping to get in terms of companies and stuff like that to come on as well?
We really do. And you mentioned it earlier, but the FDA approved a new drug that shows 2 to 3 times more efficacy in terms of weight loss than the drugs that we've been using for the last year in June. And that's a huge catalyst for the business. And we know that once that drug starts being advertised to consumers, we know that consumers are going to go knocking on their employer's door, knocking on their health plan's door, asking for access to that drug. And what we think we provide at Calibrate is the wraparound solution that proves demonstrated results and outcomes on top of the drug. So you can contain the cost long term without just agreeing to pay for the drug forever.
So let's get back to the news of the day, which is you're raising $100 million less than 2 years after you started the company. You raised money back in June of last year from Kirsten Green and Forerunners. She's a big name investor. Now you have Founders Fund on board. Tell me about what it was like for you as a founder with a tech background to push into this medical space and what you have learned and continue to learn from these investors that you brought on board.
For me, Kirsten introduced us to Brian at Founders Fund. So Kirsten Green at Forerunner introduced us to Brian Singerman at Founders Fund, who's leading the round. And she said this thing to me that has really stuck with me, which is there are founders who want investors around the table who are going to push the way that they think, who are going to push them on strategy, who are going to push the business forward. And there are founders that want investors around the table who aren't like that at all. And for me, it just really, really clicked when we met Brian at Founders Fund that was exactly what we needed for this moment in time in the business. Someone who would push us on the strategy, push us on how we think about it, someone with deep experience scaling really big businesses in really big categories. And so that's why we got really excited about adding Founders Fund to the team.
Great. And just a final thought. So what's next for the company? Now that you have this funding, you have Brian Singerman from Founders Fund on your board. What will the next couple of months and year look like?
2 really big things for us. 1, double down on the direct-to-consumer business, make Calibrate a household name. Look out for Calibrate all over TV at the end of the year and into January. And then 2, start to find the health plans that are willing to pay for Calibrate based on the results from our year 1 members.
Well, a fascinating look at a fast-growing company looking to change the way people lose weight and take care of themselves. We really appreciate you talking to us about this on the heels of this big announcement. Isabel Kenyon, thanks so much for joining us today.
Thank you, Julia.